Hi everyone, I'm Dr. Mundi from DG Aesthetics.
And I'm Kristen, I'm a physical therapist.
So we are here to talk to you about pelvic health.
I don't think anybody really realizes how many muscles we have in our pelvis. We have 3 layers of muscles that are just holding all of our organs all day while we're walking, running, jumping. They're always on.
It's a lot of work that they're doing, and things can go wrong at any time. So tell me a little bit about what's some things that go right and what's some things that go wrong when we're talking about pelvic health.
I think one thing that is very common is tight pelvic muscles. You know, we're always holding ourselves upright, right? A lot of times we hold tension in our jaw, our shoulders.
All the time.
And we don't even realize that you're holding tension in that pelvic floor. Mm-hmm. So if those muscles get tight and short, you can imagine that can lead to pain, that can lead to incontinence, leaking issues. All sorts of issues can come if we have too much tension in there.
So some people always think that like everything being loose is a problem, but you're saying things being tight can also be a problem.
Loose is a problem, but I think a bigger misconception is relaxed and weak are very different.
Right.
So you can be weak and still have a tight muscle.
I see. So it's almost like tension, but no control.
Mm-hmm.
Got it. And what are some symptoms that I would feel or any woman might feel because of this?
Number 1 would be pain. Pelvic pain is very common, and women don't even know that it's not normal. It can be common and not normal.
Right. And so does pain manifest as like pain when you're walking, pain when you're having sex, pain when you're going to the bathroom?
All the above.
Wow.
You can have, what I hear a lot is pain at the beginning of sex that goes away. That's one sort of tightness.
Right.
Pain during sex that doesn't go away. That's a different type of tightness. Pain in your hip or back that nothing seems to help. That could be coming from those pelvic floor muscles that just is not getting addressed.
So a woman with normal back pain, it could be pelvic pain.
Could be pelvic floor issues.
Wow. So how do we address that?
Well, there's this one, I would always get an examination from a doctor or physical therapist, which ideally is an internal exam, so that you can tell if the muscles are tight and get a feel for how they can be relaxed.
Now, a lot of women are scared to get these physical exams. What are some tips for women on how to feel comfortable about getting this exam and talking to their doctor or their therapist about these issues?
First, don't do anything that you're not comfortable with. So if you don't want to do that internal exam on your first visit, don't. This exam is not a gynecological exam, so it should not be uncomfortable. And there'll be a lot of talking and breathing that works your way up to it, but then just do what you're comfortable with. And even if that takes a couple of months to get used to it, that's fine, because pain could also trigger you during the exam. So don't rush into it. Talk it out.
Yeah, I think just having the conversation is the most important starting point. A lot of women just aren't comfortable talking about pain down there, whether it be tiny bits of pain, pain when walking, pain when going to the bathroom. We're all a little nervous about talking about it, but there can be safe spaces to do it, right?
And again, it's common, but not normal. So talk about it.